So for those people that like to say that those great pilots in those great planes, well, we just ordered 22 more of them, new and improved, that those great pilots didn't do their job, they did their job. At 1 o'clock in the morning with no moon, no light, no nothing, every single bomb hit its targets. And then, as you know, we shot some incredible things. There's things that nobody else has. Nobody has a military like we have. We shot the Tomahawks from a submarine 200 miles away, and that went on top of it. But every one of those, including the Tomahawks, every one of those weapons and shots hit perfectly. And they said to me, just to put it on the record, they said to me, there are only 2 countries in the entire world that could ever get that stuff out of there because we don't have the equipment and nobody else. They said China and the United States. So I just want to let you know, those pilots did an unbelievable job, very dangerous job, at 1 o'clock in the morning. Think of it, no moon, no nothing. We had no light, purposely. And every single one of those bombs were right down an air chute in a granite mountain that exploded. And they are unable to get it, even if they wanted to. But we're not going to take a chance, so that's part of the deal.
So, sir, are you saying the Iranians agreed to allow the removal of all their enriched uranium?
Yeah. Well, they did it 2 days ago. They didn't, okay? They did 2 days ago. They said, you're going to have to take it. We were going to go with them, but they changed their mind because they didn't put it in the paper. So when they sent us this document that we waited 4 days for, that should have taken 10 minutes to do, look, very simple. We get that. They guarantee no nuclear weapons for a very long period of time, and a couple of other minor things, but they just can't get there. So they agree with us, and then they take it back. But they said to us that it was so badly obliterated, was the word they actually used. That was my original word. Then it got challenged by some of the fake news. And it wasn't challenged with any knowledge. It was just challenged like they were hoping that this wouldn't have been so successful. No. It was obliterated. We have the greatest military in the world. I built it largely in my first term, and I didn't know I'd be using it quite this much in my second term. But very simply, when they say, does he have a plan? Yeah, I have a plan. The plan is very simple. You know, in war, you have to change. You have to be flexible. You have a lot of plans, but you have to do different plans in different days. But I have a great plan. But the plan is they cannot have a nuclear weapon. And they didn't say that in their letter.
Mr. President, the leadership changes that you've talked about in Iran, is this still a leadership that you believe you can negotiate with and ultimately reach a peace?
I think so. Well, you have 2. You have the moderates and you have the lunatics. And I think the moderates are more respected. The lunatics want to fight till the end. You know, it'll be a very quick fight. But I call them. You have. Just like our country, we have lunatics too. I call them lunatics, I call them stupid people too. But in Iran, they have the moderates, they're dying to make a deal, and then you have the lunatics, and I guess they're a little bit afraid of the lunatics, but, and why not? The level of ferocity for protests, you know, the people are watching it, they want to go out on the streets, they have no weapons, they have no guns. We thought the Kurds were going to give us weapons, but the Kurds disappointed us. The Kurds take. They have a great reputation in Congress. Congress says, oh, they fight so hard. No, they fight hard when they get paid. So I'm very disappointed in the Kurds. But they were given, I said it wasn't going to work, by the way. I just have to say it. I disagreed with what they did. They gave it. I said, they'll never get there. And I was right. I like to be right. In this case, too bad. But we sent some guns with ammunition, and they were supposed to be delivered, but they kept it. I said they're going to keep it, but what do I know? I've only been doing this a short period of time. What do I know?
For the time being, the ceasefire remains in place?
What?
For the time being, the ceasefire remains in place?
You know, it's unbelievably weak, I would say. I would call it the weakest right now. After reading that piece of garbage they sent us, I didn't even finish reading it. They said, I'm not going to waste my time reading it. I would say it's one of the weakest right now. It's on life support. They understand. These are all medical people. Dr. Oz, life support is not a good thing. Do you agree?
Bad prognostic.
I would say the ceasefire is on massive life support, where the doctor walks in and says, sir, your loved one has approximately a 1% chance of living. Yeah.
Mr. President,
Daniel, go ahead.
Yep.
One of the best reporters in Washington.
Thank
Go
you,
ahead.
sir. Dr. Oz referenced this a little early. 2 questions on healthcare, if I can. The Council of Economic Advisors released a report saying that the most favored nation drug deals will generate about $529 billion in domestic savings over the next 10 years across all markets. How transformative are these deals?
And makes people better.
Yeah, it does. How transformative are these deals for millions of Americans? And do you believe that the most favored nation drug deals are the Republicans' golden ticket to the midterms?
I think the Republicans should walk away with the midterms. Now, typically, whoever is president, they vote the other way. Nobody knows this. Do we have a psychiatrist in the group? Nobody knows why, because I think we've had the best president. A lot of people have said, even some radical left lunatics have said that we've had the best presidency, the best first year of any president. Look, I stopped 8 wars, got the largest tax cuts in history, the largest regulation cuts in history, all the things we've done, so many, like all of this that we've done. Medically, we've done so much. We did a thing called Right to Try at my first, and I could never understand it when I was a civilian, which wasn't so long ago. I haven't been doing it that long, but I always used to marvel at the fact that if they had a great drug and it had to go through the FDA, and the FDA guarded it and said, you can't use it, and if a person was terminally ill and the drug was showing great promise, the person's terminally ill, they wouldn't give it to the person because they didn't want to hurt the person. And I said, well, we need something on that. And it was very important to me. And I had no idea it would be so hard to get, but we got it in total. We got it in full. It's called Right to Try. That if you're terminally ill, you have the right to try a drug that has not gone even anywhere near final. If it shows even a little promise. And we've saved thousands of lives. It was very hard to get because the insurance companies didn't want it, the doctors didn't want it, because the doctors didn't want to be blamed. The drug companies didn't want it because if it didn't work, they didn't want it on their record. So what we did is we said, we're not going to count it on your record. If somebody's terminally ill and they take the drug, it doesn't work, we're not going to count it on your record. We'll have another record, a little smaller one that not a lot of people look at, but we're not going to count it on your record. So Right to Try has been one of the great successes. Again, nobody talks about it. We've saved thousands of lives, but you know what is maybe even more important? We've learned very quickly that some drugs work and some drugs don't. In other words, some drugs take a person who's terminally ill, and there are numerous cases, and without waiting 7 years, 10 years, by the way, we think we've cut it in half, but you do need a period of time. Without waiting many, many years, we know the drug works because we've taken people that were dead. We had a person given the last rites, gone. The kids are crying and started them on this drug, and the person became better. It works, and some don't work. But you learn really fast. It's called the ultimate test, I think, right? They test all these things. They use animals all over the place. They use everything to test. Person's going to die. So they didn't want it because they didn't want to be sued for, the drug companies didn't want to be sued if it didn't work. The country didn't want to be sued. So I got everybody into a room, and I said, we're going to do this, but if anybody uses it, they have to sign a document. They sign a very strong document that they're not going to sue the doctor, they're not going to sue the country, they're not going to sue the manufacturer, the pharmaceutical company, they're not going to sue anybody, but we're going to give it a shot. It has been, Right to Try has been so successful. It's been amazing. Nobody talks about it, but everyone knows how successful.
Mr. President, there was a young man that we visited actually in Los Angeles, who's taking advantage of this program. Katie actually spoke to him by phone. It's from Alabama. That he reached out to you directly, and this is the same program that benefited him. And just to put numbers on the Council of Economic Advisors, it's between 500 and whatever it was, 30 million that you said, and $700 billion in savings. So we estimated $600 billion in total savings, and the impact on the American people, Mr. President, is 1 in 3 Americans leave a drugstore without their medication because they can't afford it. Even though they got a doctor's prescription, they know they can make a difference in their lives, that will no longer happen with the most favored nation drug pricing. And we're giving drugs like which, as you call it, the fat shot, the weight loss drugs to all beneficiaries of Medicare. Every senior in America can get them for $50 starting on July 1st. These are just inconceivably good prices, and they're so good, in fact, that we actually save the taxpayer money by reducing the downstream effects of obesity, diabetes, and hypertension. Mr. President, all possible because you took brave action. And again, the quick question we should be asking ourselves is why didn't this happen a decade ago? Katie, what do you think about that young man?
That he has a new lease on hope, and it's because of you. I talked to his parents, and they said, we feel so good about our country that we literally have the president and Dr. Oz and Secretary Kennedy doing everything possible to give our son a fighting chance. They said before, no one was listening, but you, Mr. President, took action. And Will Roberts, he is such a great young man.
Well, Right
He's
to
inspired
Try
so many people.
Nobody talks about
We're with him.
thousands of people, but it's also like this incredible laboratory of people that they're finished, they're terminally ill, they're not going to live, and we weren't given. And this went on for years. This went on. Madam Secretary, you're doing such a good job with prices, agriculture. How's the beef doing? We got to get the beef down.
We're working on it.
It's the only thing. We got to get the beef down. But
It's becoming
but
more affordable.
This was so incredible because, and I marveled at it for 30 years and say, why? I'd have friends that were terminally ill. You'd meet people. They were really in bad shape. They weren't going to make it, and they couldn't get a drug that looked like it was going to work. They couldn't get it. They asked me to get it. You have contacts. Could you get it? You couldn't get it. You go to jail if you get. And they were going to die. They'd die 3 weeks later, 4 weeks later. And we're saving a lot of people that were gone, that were terminally ill. And what we're doing is producing almost immediately. You can almost immediately approve these drugs. But it was very, look, legally it was a disaster because everybody would be sued. The problem is somebody would die, and then they blame the drug, and then the drug company gets sued, the doctors, the country gets sued. A member of the family goes crazy, and you're settling for millions of dollars because you killed somebody that was going to be dead in 2 weeks. So I did that, and I'm very proud of it. The other thing, doctor mentioned the fat drug. So think of it. $87 it would sell in London, and $1,300 in New York for the exact same box, made, I won't name the company, made by the same company in the same facility. $87 in London, $87 in Heidelberg, $87 in Paris, $1,370 in New York. And this went on for a long time. And I want to tell you, he could be a famous guy. He's begging me not to release his name. He's a very highly neurotic, very fat, sort of a fat slob, I would call him. But he's a brilliant man. We know many of those people. He's a brilliant guy, actually. But he said, President, what the hell's going on here? He didn't need the money. He's rich as hell. But he just couldn't understand why he had to pay so little in London. He went to London, and he couldn't understand it. He said, this is crazy. And it actually motivated me in a certain way because he was very smart. He did a study. He actually sent his people, and he traced this medicine, and he found out it was, the box here is the same box as he had in New York. It was made in the same plant, and it cost 10 times more here than it did in London. And that there are worse stories than that. And I said, that's it. It's over. We're going to do it. That got me really motivated. He's begging me not to release his name because he is a well-known person. And I've so destroyed his reputation in terms of his physicality that he just doesn't want me. I said, you've had a big impact on medicine because you got to me better than any normal person could have, He said, no, I don't want to. Okay, yeah, please.
Mr. President, what do you hope to get out of the summit in China, and how much has the war in Iran
A lot.
changed the agenda?
Look, I have a great relationship with President Xi. We're doing a lot of business, but it's smart business. We used to be taken advantage of for years with our previous presidents, and now we're doing great with China. We make a lot of money with China. I have a great relationship with President Xi. And I think you can see that with the fact that in Hormuz, they get a big percentage, 40% of their oil from Hormuz. There's been no ships coming in, no nasty ships coming in that we end up in skirmishes with. He'd like to see it get done. He doesn't want to see, I'll tell you what, look, I respect him a lot. and hopefully he respects me. He didn't respect our previous government, that I can tell you. The guy couldn't talk. It was ridiculous how that ever happened. Our country was hurt so badly the last 4 years. You know, I say it all the time. It was the king of Saudi Arabia, but everybody says it. We were a dead country a year and a half ago, and now we're the hottest country anywhere in the world. And you know that better than anybody. You know, you see that. Olivia sees that. You see it in the numbers. Look at the numbers. Look at the stock market. The stock market is now higher than it was when this war started. So I thought that would go down 20, 25%. It was fine. You know, I'm willing to, it's a terrible expression, take a bullet. It's a terrible expression, especially when it's used by me. But I am. I'm willing to take a bullet for the country. And I said, look, the stock market's going to go down, but we're going to have a threat of lunatics having a nuclear weapon. I deal with them. I say it to them. I say, you people are crazy. I deal with them. They talk differently. I say, you're crazy. You're crazy people. You're nuts. You're not having a nuclear weapon. They think they can talk me into it, and they don't do very well with it. But they know how I feel. They can't have a nuclear weapon. They would use it within an hour after getting it. If the Obama deal wasn't terminated by me, they would have had it 6 years ago. And they would have used it immediately on Israel and also the rest of the Middle East. You saw that when they started shooting rockets. Nobody thought Saudi Arabia and Qatar and UAE were going to get hit, or Kuwait, Bahrain. I think it was a tremendous strategic mistake, and they wasted those missiles. We have the Patriots that knocked them down every time. You know, I told the story, we were shot at one of our great assets, happened to be a ship, great ship. 111 missiles going at very high rates of speed, sophisticated equipment. And, you know, that's all they did is build missiles. They had thousands of missiles. Who does this except for people that are looking for trouble? We had 111 shot at one of our ships over a very short period of time. Out of 111 missiles going at 3,000 miles an hour, all 111 missiles were knocked down into the ocean long prior to arriving at the target. And the coolest guys are the guys that do this. You know, they're not brawn, they're brain. They sit there, missile shot. You got to see it happening. Missiles coming. They got like about 13 seconds to make a decision. It's not like, gee, let's figure it out. They make a wrong calculation. You know, you lose a lot of men, and a lot of $1 billion times 10 ships. So, but there's a level of coolness that missile shot, they look, and you know, they're going, heading 47 degrees north, 1,300 feet, going 3,000 miles an hour. Okay, we have it in our sight. Fire, boom. 10 seconds left. Let me tell you, they need smart people. These people are smart. Amazing. And they're so smart that they're cool. You know, under the calculations, for some people are very tough. For other people, not so tough. There's, you know, about 1%. There's not too many. There's not too many people around like that. I say, a lot of times I'll call these gunners because they're phenomenal geniuses. You know, where did you go to school? I went to MIT. Where did you go to school? I went to the best schools. Smart. You got to be smart. We have the greatest military in the world. Okay.
Just President, back to motherhood. Your one big beautiful bill.
I like that. Because this is about motherhood, not about the beautiful country of Iran. Go ahead.
Thank you all for being here. Your one big beautiful bill defunded Planned Parenthood for 1 year, but that expires on this July 4th. Would you like Congress to use representation?
Well, we're going to see what happens. Congress is now negotiating. We've been very good for the people that want it, for the people that are here, and we'll see how that goes. It's been a very thorny, to put it mildly, it's been a very thorny issue. It's all under negotiation right now. Yes, ma'am.
Would you like to see that defund?
Yeah, go ahead, please.
Thank you, Mr. President. What do you think about the handling of the hantavirus by the U.S.?
I think fine.
Do you regret withdrawing from the WHO? Given that
No, I'm glad. So we were paying the World Health Organization $500 million a year. Look, it's a lot of money, but in the overall scope, it's not that much, but it's a lot of money. And we weren't being treated well, and they were making the wrong diagnoses. I was the one that said it came from Wuhan. They didn't say that. They refused to say that because they were totally owned by China. So I was saying it came from Wuhan. They didn't want to say that. Now it's turned out, I think it's been conclusive that it came from Wuhan. But I said that on the first day because I saw satellite pictures with body bags all over Wuhan, literally all over Wuhan. So I said that they lied to me or they didn't know. So we were paying for, let's say, 350 million people. We were paying $500 million a year to the World Health Organization. That's a lot of money. What the hell are they going to do with that kind of money? And China was paying $39 million a year for 1.4 billion people. So I said, you know, you got your story wrong because we should be paying about $10 million, not $500 million. And they were willing to negotiate, but it was so popular when I pulled out. They gave us all wrong information. On COVID, they were totally wrong. And I looked today and I saw the same doctor that was there. He's a good politician. I don't know how the hell he kept his job, but he was there telling us about this. Now, the one thing with this one is that it's much harder to catch. And we've had it for a long, it's been around for a long time. People are very familiar with it. So, you know, I hope it's fine. All I can do is everything that a president can do, which is actually somewhat limited. But it seems like it is not easy to spread. In fact, it's in certain ways very hard to spread. It's been, we've lived with it for years, many years, and we think we're in very good shape. We're very careful. And Nebraska has done a fantastic job. They have a place there that those doctors are unbelievable, the job they've done. Yeah, please.
Mr. President, are you going to suspend the federal gas tax?
Yeah, I'm going to reduce until let me tell you, as soon as this is over with Iran, as soon as it's over, you're going to see gasoline and oil drop like a rock. Going to be dropping down like a rock. I mean, already, look, just on the basis of, you know, things have happened. When it first came about, 20% of the oil came out of Hormuz. That's a lot. But, you know, with time, it's like they go into Texas, they go into Louisiana, they go into Alaska, a lot of Alaska. Alaska's, you know, sort of, it seems like very far away from Asia, but it's actually a relatively short trip by comparison to other locations they have to go to get oil. And they go into Alaska. In fact, our big problem is we're building bigger docking, to fill up. But we have, we've become very big on the filling station. We're a big filling station. And what's happening is, when people heard about losing Hormuz, they said, oh, it's genius. They're finding other locations. And some of those people, I spoke to them, companies and countries, some of those people are going to continue to go to Texas. They like it better. They said it's an extra 45 minutes. They like it better. And it's sort of amazing, you know, it found its way. So a lot of people thought oil would go to $250, $300. It's not. I mean, today it's at less than 100. Think of that. Now, when this ends, you're going to see it drop like a rock.
How long are you going to suspend that tax for?
Till it's appropriate, yeah.
Mr. President,
It's a small percentage, but it's still money.
Mr. President, do you still believe a diplomatic solution is possible with Iran, or do you only have military options left?
No, I think it's very possible. Look, I've had to deal with them 4 or 5 times. They change their mind. They're very dishonorable people. The leadership. Don't forget, it's the 3rd level. The 1st level is gone. They were unreasonable. The 2nd level is more reasonable. The 3rd level, nobody wants to be president, you know? They say, who wants to be president? There's nobody raises their hand, you know? But they change their mind. I've had that in business many times. The mind changers, you call them. These people that you make a deal, and then the next day they send you a document that takes 5 5 days to get there when it should have been there in 20 minutes. You know, it's a pretty simple document. They will never have a nuclear weapon, yeah?
Thank you, sir. I was speaking with Claire Lai this morning. She's the daughter of Jimmy Lai, and she told me that she's been praying and hoping that you'll be the one that brings her dad home. She says of any administration, she thinks you're the one that could do it.
You said Jimmy Lai.
Jimmy Lai's daughter.
And there's another gentleman, a minister, pastor, as you know. I'll bring them both up. I brought it up before. Jimmy Lai I brought up. The other one I just heard about this morning, actually. And I do bring that up. You know, we've gotten, I don't know if you've been reading, John Cole, who's a great lawyer. He was a tobacco lawyer. Great guy. I won't say he's an older guy because he may be offended by that, but he is. He's a little older, and he's a wise man, actually. He made a fortune with the tobacco. He did the first tobacco lawsuit, and he's a great man. And he's brought back hundreds of people out of various Belarus. You know, you read about that. We had, and the leader has been fantastic. But somebody has to ask him. Biden never asked. We asked. And we're getting hundreds of people out of confinement and prisons that shouldn't be there, and hundreds, and many of them aren't even citizens of the United States. They're people that have been captured in some form, ministers, people that are really innocent people, and they're being held captive. And I bring up Jimmy Lai. Now, Jimmy Lai, he caused a lot of bedlam. I don't know. It's like saying to me, if Comey ever went to jail, would you let him out? It might be a hard one for me. Does that make sense? It might be a hard one to me, because he's a dirty cop. But Jimmy Lai isn't that way. But Jimmy Lai, he caused lots of turmoil for China. He tried to do the right thing. He wasn't successful, went to jail, and people would like him out, and I'd like to see him get out too. So I'll bring him up again. I have brought him up. There's another gentleman, a pastor, as you know, with a beautiful daughter and son-in-law that would like to see him get out. I'm going to bring his name up.
Mr. President, what about Taiwan? Do you expect Taiwan to come up in your negotiations?
Yeah, it always comes up. It always comes up. It's. I used to say Ukraine would. 4 years you never even heard the word Ukraine. It was never going to happen, and it was handled so badly. Ukraine should have never come up. They lost last month 25,000 soldiers, both sides. 25,000. They're losing on average 25,000 soldiers. It's like a meat grinder. It's horrible what's happening. That would have never happened had the election not been rigged. That would have never happened. And Putin and I would talk about it, but there was never he would have never done it. Taiwan, I equate it a little bit to that. If you have the right president, I don't think it'll happen. I think we'll be fine. I have a very good relationship with President Xi. He knows I don't want that to happen. Very far away, very far away. We're just at 9,500 miles. We're 9,500 miles. He's 67 miles. It's a little bit of a difference, but there's a lot of support for Taiwan from Japan and from countries from that area.
Do you think we should still be selling them weapons? The United States should
Well, I'm going to have that
weapons
discussion with President Xi. President Xi would like us not to, and I'll have that discussion. That's one of the many things I'll be talking about. We'll have he and I have gotten along well, other than with COVID. I was just not accepting of what happened with COVID. But other than that, he and I have he's a great gentleman. I find him to be an amazing man. And when I say that, the press always says, "Oh, that's terrible that he called him." He runs 1.4 billion people with a pretty iron fist. He loves his country. I can tell you that, President Xi. I look forward to being there. And if he felt anything, we wouldn't be doing it. But a lot of good things can happen. Now, we'll be talking about, he'll bring up Taiwan, I think, more than I will. But I think that a discussion will be a little bit about energy and about the very beautiful country of Iran.
Mr. President.
And by the way, Iran is a beautiful country, but it's got people running it now that shouldn't be there perhaps.
Mr. President, just a couple questions. Outside of these amazing benefits from employers for IVF, there are a lot of women out there who either they work part-time or they self-pay for health insurance. Is there an option for cheaper IVF for those women?
And what would you like to know?
For IVF, bring it down to the cost that's associated.
I don't know. Olivia, could you answer that question, please?
We're trying to
We're
make.
putting her through a little training here, Tom. See whether or not she's got it. I have no doubt she does. Go ahead.
Just a softball from the president. And Healthy Moms,
I
Healthy
said,
Babies America.
let's give this one to Olivia.
We are focused on making America the safest and best place to have a baby. The IVF question, I think, can probably be better hit by Senator Britt
Absolutely.
and Dr. Fink and others.
Yeah, so what we're trying to do is obviously make sure that people have greater access and that the affordability goes down. We did that obviously with what you saw from the president last year and the 2 different announcements he made. We've seen, over, thousands of people have more access with regards to affordability. I think we've saved about $15 million, but we know that this is going to go up to the tunes of billions of dollars with what we're doing here. With being able to allow employers to do this, we think it will ultimately drive down to each and every person. So that is the point. The more that people are able, we want to get, as Secretary Kennedy said, we want to get to root causes as well. So we want to make sure that we are treating the entire issue, not just putting a Band-Aid on it and moving on. We want people who want to bring life into the world to have that opportunity. We do believe that this will do that. So a combination of allowing this to be available, but then also the affordability element. I think it's down, as he said, some of these drugs down 80% from a year ago, some down 40% over a year ago. So it's a really exciting time, and we do think that this will ultimately be able to reach all Americans.
But a lot of people don't realize it's available. I spoke to people, they don't know about the Trump, they don't know about any of these things that, where you're saving so much money, where they can actually afford it. When you get prices down to just a tiny fraction of what they used to be, that's one of the reasons I don't need it for myself. I get enough publicity. But I need it to inform the public. A lot of people, like your question's a good question, but a lot of people don't know IVF and so many other things that could help them, that they assume it's so expensive, it's not within their price range, and they're not going to be able to afford it or even think about it. And then they hear about these numbers. And in addition, there's some help that we give them beyond even the low numbers.
Mr. President, only 1 in 3 Americans know what TrumpRx.gov does. It would be a great service. I know he kids you a lot about this not getting reported appropriately, but there is no excuse to buy drugs. Make sure you're getting the best. And sir, we've got tens of millions of people who are going to it, but there's hundreds of millions of Americans. So we have got to get Americans to realize. You mentioned fertility. Fertility drugs are probably a third of the cost of the entire process. For those to drop by 90% dramatically changes the equation. And there are private companies who are now taking advantage of the whole group of individuals who can get access to fertility medications and the treatments that go with them. And as the services get better, we make them more affordable, we'll have more Trump babies.
Yeah, and we hope that that lays the groundwork, though, so that anyone has an ability to receive these. And also remember, this is all on moms.gov as well. Yeah. That's one thing we're trying to do, is make sure that we are pushing people to all of these resources, because when you either want to have a child or you find out you have a child, sometimes that's a very exciting thing. Sometimes, you're a little overwhelmed. We want all of those resources to be in one spot so that we can help these women in their journey to motherhood.
And when people hear how inexpensive it is relative, they can't even think about it. Now all of a sudden they say, I can afford that. And they get help also in affording it. There are ways of getting help to afford even those low prices. How about one more last question, please?
Thank you, Mr. President. What do you say to infectious diseases experts who say they're worried the country may not be prepared to deal with something like hantavirus because of all the HHS, funding and staffing cuts?
Well, I think we take care of that, Dot. And you want to answer that?
It's just not true. Jay Bhattacharya is taking this task on. Secretary Kennedy is involved with them. You can speak to perhaps even better than, in fact, best in the room. But the country's prepared. The CDC is focused on it, and the agency is well aware of the opportunities to actually treat this problem, not just try to prevent it in the future, but treat it if it happens now. Secretary?
Yeah, we've had CDC teams on it from day one. I was speaking with the University of Nebraska since the second day of the outbreak. I was speaking with Governor Billen of Nebraska. We had a CDC team at Tenerife. We had airplanes ready to take the patients, the 17 patients, off the vessel and transport. 2 of them went to Atlanta. One of those was symptomatic. They're in a biocontainment lab in Atlanta. The other 16 are now in Nebraska. One of them is symptomatic. He is in the biocontainment lab. The other ones are being tested and supervised and given plans for going home. We have this under control and we're not worried about it.
But the CDC took 4 days after the WHO issued its, alert. Why was it? Why did it take the US 4 days to issue an alert?
It's not true. As soon as we determined that the virus was out there, we issued an alert. The alert means nothing.
They acted very quickly. I saw the alert too. Give me a break. They acted very, very quickly, and it looks like, and can't bet anybody's life on it, but it looks like it's just a disease that we've had around in a very small way for a long time. Not a good one to catch because, it's a very severe disease if you catch it, but it's very hard to catch. Daniel, did you have a question?
One last one. Senator Britt mentioned the website moms.gov. One of the policies that's on there
Right.
are the Trump accounts, right? They're getting ready to go live this summer. When you speak to young parents, this is one of the policies they repeatedly bring up about how impactful it will be for them. Can you just talk about why Americans need to know about this and how important it is for younger parents to give their kids a head
So
start?
we've done more for young parents, I guess it's the way you could say it. It's a great, beautiful term. But we've done more for young parents than any administration ever in history, and we're going to continue to do so. This is, look at the people up here, they're all like brilliant. I'm one of the young ones,
That's right.
I'm a similar age to all of you. Very similar. I feel the same as them. I actually feel, for sure. I don't know what this is. I feel the same as I did 50 years ago. Yeah. It's crazy. Someday there'll be a day when that won't happen. I'll let Bobby and Oz know, It's not quite the same. But I feel literally the same. I don't know why. It's not because I eat the best foods. Maybe they are the best foods. Who knows what the best foods are? Maybe junk food is good and the other food is no good. I know people that eat the best food. They go to a restaurant, they have celery, and I don't want, and I'll have steak and everything else. And I say, how you doing? Well, it's over for me at a young age. And all they do is watch it. I know many, many people that all they do is watch their weight, their this, their that. And they kick the bucket, and here we are. I feel great. Thank you, Daniel. Thank you very much, everybody. Have a good time.
Thank you, guys.
Pulitzer Prize winner, right?
Thank you, guys. Thank you, guys.